Big Brother City 2035, 7 a.m. Thomas, 55, is in bed and his alarm clock rings. You've slept for 6 hours and 14 minutes as his smartphone connected up to sensors under the mattress. In the toilets, his urine is immediately analysed. Nothing wrong there. Then it's time to get on the scales. Bad news. The connected scales show that in 1 week his fat body weight has gone up 3%. If this continues, the complementary health scheme will increase his premium again because they have immediate access to all his data. At work, a question flicks up on his smartphone. Do you feel stressed? His connected watch strap has given the game away. His pulse was a little bit too fast because he had an interview with his manager earlier. At 6 p.m. when he leaves work, Thomas is tempted to get in his car, but the weather is fine. You should walk in the sunshine. Your vitamin D level is too long and you haven't yet taken your 7,000 steps today, his smartphone tells him. Thomas arrives at the sports club. When he clocks in his member's card, his health insurance scheme is informed of his arrival. 20 minutes later, they check that he's still there by locating him on his smartphone. When he leaves, Thomas dreams of French fries, but he's already swallowed 2,200 calories during the day, and it wouldn't go down well with the health fund at all. He hasn't yet got over the €15 increase he had to pay last year for smoking a cigarette. He'd forgotten that the sensors in his watch picked up tobacco smoke, and he feels rather nostalgic. He was one of the first to have one of these watches. His health fund partly paid for the watch in 2015 when he bought it against access to his data. If only he'd known at the time he was 35 and thought it would be great fun. He felt encouraged to take care of his health, and he was also happy to get gift vouchers when he did an hour sports a day. But since the system has changed, no more rewards, at least little extra that's bad for his health, Thomas has to pay a fine, and the health scheme is informed. It's for your own good, his advisor always repeats. You must understand that our interest is that you should not fall ill.